37-year-old female with advanced invasive ductal carcinoma who presents with. This is how I started my morning presentation about you, as I tried to put into a concise assessment what brought you into the hospital. But that does not even begin to tell your story, now does it? The first time I met you was on a Tuesday morning around 6 a.m., as I woke you up to interview and do a physical exam on you. Though it was so early and you looked so visibly tired, you exuded such warmth and spoke to me in the kindest manner. That first morning, you started to share with me your fight with breast cancer so far, how a lump found by your family physician turned out to be breast cancer. You were given the diagnosis in 2015 when you were just 35 years old, and following extensive treatment, you were later told you had a clean bill of health a year later in June of 2016. That was one of the happiest days of your life, you told me. But that wasn't where the story ended, now was it? Only a few months later, in September of 2016, you started to feel a vague pain in your ribs. You expressed these concerns to your oncologist, who at the time you trusted implicitly. She reassured you by telling you were merely exerting yourself too much in physical therapy and to slow it down. However, you were not completely satisfied, as is your right as a patient in charge of her own health care. You reiterated your feelings at a few more visits, as the pain seemed to persist. But you were not heard until March of 2017, almost 6 months after the onset of symptoms, when your family doctor finally heard what you were saying. So, a chest x-ray was ordered, which showed suspicious findings. This eventually led to a workup that showed that not only had your cancer returned, but it had also metastasized extensively to the lungs. As if this wasn't enough, you were then told that the mets were so extensive that chemotherapy, radiation, and surgery were no longer options available to allow you to fight this cancer. At most, they would lessen your pain and suffering for the rest of your days. 37-year-old female with advanced invasive ductal carcinoma who presents with worsening shortness of breath and hypoxemia consistent with acute respiratory failure secondary to extensive lung metastases. As I finished off my presentation that day with my plan for what I'd like to do for you in the hospital, I could not help but think of how much I can't do for you. I can't take away how scared you must feel at the thought of having to leave your new husband and teenage daughter behind. You told me how you'd finally gotten it right with this one, how excited you had been to start a family with him, until the recurrence of your cancer stripped you of that dream. I can't take away the pain you must constantly be in, and the fogginess you've complained about that comes when you take the pain medications. I can't take away the misguided treatment you have received in the past from other doctors who did not take the time to truly listen to you. But though I cannot do these things, I promise I will do whatever I can to make your hospital stay more comfortable. I will fight for your autonomy, even though my position as a medical student does not provide me with a loud voice. I will make sure your voice is heard, and that the care we provide you takes into consideration what you want, and not just what we, as your providers, think is best. Most of all, I promise you when I'm taking care of other patients, you will always be in the back of my mind. Thinking of you, I'll remind myself that a patient knows their own body better than any medical fact out there. Thinking of you, I'll remind myself to respect a patient's wishes and to never violate their autonomy. Thinking of you, even on the rough days where I've been in the hospital for way too long, and even with patients who may seem difficult, I will think of you, and I will listen.